very casual, so we'll talk about some basic first aid. And yes, I'm a critical care resident here. You guys met Alex this morning, who's also my resident mate. So we'll go through some basic things. First, we're going to talk about some basic animal care. We're going to do preventing a crisis because being prepared is the best thing. And then just some basic emergencies that we see through here, through the ER. We'll go through kind of all of these. And hopefully you guys haven't experienced any of these, but if you have, hopefully we can give you some more information. So basic animal care. The first things first is establishing a good relationship with your primary care veterinarian, doing your yearly physical exams, vaccines, preventing those common diseases that we do see, flea and tick prevention, heartworm prevention. The other thing is good nutrition. Obviously there's a slew of foods out there these days. You know, finding out what to feed your pet is an important part of that. Healthy weight. Yes, we love to give all of our pets lots of over-the-counter table scraps, those types of things, but keeping them fit and healthy is very important, just like us. Clean and safe environments, and then obviously exercise. So preventing a crisis, although we hope we don't see you in the ER, it definitely is something we see commonly. So being prepared, maintaining a safe environment, which we kind of touched on, making sure that your pet is on a leash, you're keeping medications that are around the house locked and safe. Although we think, you know, they can't get into that bag or that cupboard, we know that animals can definitely get into all of those things. You know, also knowing where your ER hospitals are. Here in Manhattan, there's lots of them, so if you're on the west side or the east side or wherever, there's definitely different hospitals that may be closer. Obviously come to the AMC, we're happy to see you here. List of taxi services, knowing their medical records, knowing what medications your pets are on, those are all things that can be very helpful to us. And then having the ASPCA poison control. This is a hotline that is 24/7. You can give them a call if you're worried about your pet got into a plant, different medications. You can even take a picture of that plant and you can email it to them, those types of things. So if you ever have a concern about something they consumed, calling them is really helpful. It may even save you a visit to the ER, and it's also very helpful for us. We can talk to that toxicologist, we can get their recommendations, and so we really like when people call the ASPCA poison control. And then obviously you can have a list of names of other pets, or knowing if your pet goes to dog parks, boarding, that type of thing can be very helpful. So when an emergency arises, always stay calm. This is something we try to do, but you know, in those situations we can definitely be very frightened. Bring them in. Don't get bitten. You know, even though this may have been your pet for the past 6 years, if they are injured, you know, they're not going to respond the same way. They may be very painful and they're going to lash out and bite. So definitely just be cautious. Don't go online. I'm sure lots of people hear this, and you know, we're all culprits of Googling the first thing when we have our own symptoms. So, you know, even if you look it up online, you know, don't take what online says to heart. Contact a veterinarian. Call us in the ER. We answer the phone. Call your primary care veterinarian. And then first aid kits, which is something we'll talk about. This is something you can have at home with lots of different stuff, and we'll touch on that later. And then another very important thing is please don't give your pets any over-the-counter medications. Pets aren't humans. Those medications weren't made for them, and they can actually be a lot more harmful than they are helpful. So before, you know, that happens, definitely bring them in. Another thing I just wanted to say is, you know, if your pet does have an emergency or gets hurt, you know, and it's pretty severe, I would encourage you guys to bring them to an emergency room versus your primary care veterinarian. We love our primary care veterinarians, but sometimes when we talk about treating our pets in an emergent situation, getting them to an ER first may actually help them just in the fast sense in terms of going to your general practitioner and then coming to us secondary. So if you do feel like it is an extreme emergency, that may be helpful too. So here's our pet first aid kit. So having context, your primary care veterinarian and us as your closest emergency, and then poison control, which we also talked about. I think for everybody, a first aid kit can be different, especially if your pet has other health issues. You know, maybe having some extra medications in it. If your pet is chronically on some medications, having bandage material, small towels. You know, this is just like having a child that may get hurt, and we're having accessibility to some materials like this. Hydrogen peroxide, which is something we'll kind of touch on later in terms of using it to clean wounds versus some people can use it to induce vomiting if our pets get into something. Maybe a thermometer when we talk about something like heat stroke, eyedroppers, a muzzle, again, if your pet is injured and you need to pick them up, placing that muzzle. A leash, and then Benadryl is something that over-the-counter wise we are able to give our pets. An eye wash. Again, these are just some suggestions, and I think for everybody it is different, just depending on what your pet needs. I think, you know, we see a lot of this and hear a lot about cardiopulmonary resuscitation, also known as CPR. I think there's definitely things online where we see people giving CPR to their pets. And so the components of this is mouth to snout and chest compressions. But again, I encourage you that if you are worried that your pet is imminently, you know, having issues or may have passed away, getting them to the closest ER, because doing things like CPR is going to be better done by trained medical staff and veterinarians. So, you know, I think, again, we see some of these things online which may or may not be true, and I just encourage you to bring them to the ER as soon as possible. So I'm going to go through some typical emergencies that we see in the ER, which again, you guys may have experienced. Common emergencies when it comes to the eye, we have corneal lacerations and ulcers. Proptosis, so lots of you I'm sure own small little dogs with smushy faces where their eyeballs are kind of sticking out, and these guys are definitely prone to having some of their eyes pop out a little bit from playing, you know, all sorts of different things, and so that's something very common. They can get foreign bodies into their eye or chemical irritation. So if you see your pet squinting, abnormal discharge from their eye, everything looks very red, maybe they're scratching at their eye a bunch, this is something that I would encourage you to have them seen for it. There can be swelling, because this can be very painful, uncomfortable, and if an ulcer continues, you know, they can have rupture of that eye. So it's definitely something we encourage you to see. So what you could do, if you're worried they were playing and maybe they got a stick in their eye, that eye cleanser that maybe is in your first aid kit, you could flush out their eye. You keep the pet from scratching it. They can make things worse. And then seek veterinary care. So, you know, don't administer anything over the counter. We've definitely seen Neosporin in the eye and those types of things. So I encourage you guys just to see a veterinarian. We can get you those meds, because again, that can cause more harm than, you know, we hope that it's helping them. So if there is a foreign object in there, you see that stick stuck in there, don't pull it out. Just let us do it, okay? Next, we're going to talk about GI emergencies. This is probably the most common emergency that we see. You know, your pet is vomiting, your pet is having diarrhea. There may even be some blood in that diarrhea, and that prompts you to bring them in. It's always definitely worthwhile having them checked for these signs, especially our little dogs, because one, could they have gotten into something and gotten obstructed? This is something you hear about a lot, and this is something that occurs a lot. You know, they may have eaten a sock. You know, we probably have a laundry list of different objects we've pulled out of our pets. Foreign bodies, yes. And then bloat. This here is a picture of, you guys may have heard of bloat or big dogs getting their stomach twisted. The normal doctor term for this is called gastric dilatation volvulus. And this is going to occur in those big Great Danes, standard poodles, dogs that have, you know, a deep chest and room for their stomach to rotate. So if you see your pet vomiting, diarrhea, the retching and unproductive vomiting. That's going to go more with our pets that may have a bloat, lethargy, lack of appetite. Then I would encourage you guys to bring them in. Again, the big thing is dehydration. Our little dogs, may have some vomiting and diarrhea, and they can definitely get very dehydrated very quickly. So please bring them in. One thing we wanted to touch on is a linear foreign body. So, our cats playing with yarn, dental floss, they definitely like to play, and then they will consume this. This is probably the most common foreign body that we're going to see in a cat. Sometimes, like this picture shows, you can see even the object under their tongue because it gets stuck and wrapped around their tongue, and what happens is it goes into their GI tract and it can't get out, and so their GI tract bunches up on it and it gets very kind of squished together. And so this is going to be your cat that just nonstop is vomiting, doesn't want to eat, it's lethargic, and obviously encourage you to bring it in. We've definitely seen them also where they'll try to defecate out that string, and you'll see a part of it. The big thing with this is do not pull that string. It may be stuck somewhere, and we could cause more harm than good of trying to remove that string. So when we see a cat coming in that we're concerned about, again, this is going to be our younger cats that are playing a lot more, consuming things they shouldn't. We always look under their tongue, and if we see that, we will recommend surgery to remove it, but don't pull it out. So vomiting and diarrhea. Going back to this, because again, this is definitely one of our common emergencies. If your pet is having some vomiting and diarrhea, you obviously don't have to rush them in first thing. You can try some at-home stuff, just like us. We all get tummy aches, and we all have these signs, and we can try to just see if it's a little bug. So you can withhold food. Some people say up to 12 hours. I always recommend, especially in these little dogs, that you're only withholding food for about 4 hours. Because if they are small, they are having vomiting and diarrhea, their blood sugar can get really low. So I think it's important that we do offer them some food sooner than 12 hours. Usually, if it's just diarrhea, you can feed them. But, when we talk about food, it's like a bland diet, chicken and rice, something very bland, just like if we all feel bad and we just want some chicken noodle soup. I think it's the same thing for these guys. Something bland, small amounts, multiple times throughout the day. Just give them a little bit. If they're eating, that's a great sign. Diarrhea may take a few days to resolve, but as long as your pet is getting better, wanting to eat, and still having an okay activity level, then I think it's okay to try to get through these things at home. Make sure water is available. Just like I've said, these little guys can get dehydrated and it can get really severe really quickly. And so if you see that your pet doesn't want to eat, the diarrhea is profusive, we're now vomiting, definitely bring them in to have them evaluated. Again, don't administer any medications over the counter. And then don't withhold food too long, but those are some big take-home points for you guys. Again, we talked about bloat. In the city, I would say we less commonly see this because more people have smaller dogs, but it is a common emergency for those big, deep-chested dogs. For whatever reason, their stomach can basically flip. And when it flips, it causes this, let me use this pointer here. Oh, wrong one. There we go. So it creates this bubble up here because this is supposed to be down here. And so when that happens, basically air and air and air just distends their stomach. Nothing can pass through. They're sort of retching. They're uncomfortable. Their bellies are going to get big and bloated. And this is a medical emergency. So if any of you have a big dogs and you notice these things at home, definitely bring them in very soon. Other than that, in terms of bloat, if it happens, you'll usually know pretty quickly, and I would say people do a pretty good job of getting them to the ER. Another common emergency is going to be musculoskeletal. So, your pet is limping, he may have jumped off the couch, those types of things. We can see fracture, soft tissue injuries. This is a picture of a cat here on a ledge. Unfortunately, in New York, we have things like high-rise syndrome because when it's spring or people start opening their windows, cats start falling out of windows. So this is something we do commonly see here. And with high-rise cats, there's definitely specific injuries depending on how far they fall. But also we see soft tissue injuries from trauma and strain. We see back-related issues, and our pets can fracture things. These small dogs with small forelimbs, they jump off the couch and they can fracture these bones here. I would say this is probably the most common fracture we see in those small little dogs that jump off the couch. And this is your radius and your ulna. And we do recommend surgical fixation usually of these fractures. So if you see your pet limping, non-weight bearing, swelling, painful, those types of things, I would recommend them being seen. A lot of times they could just be a soft tissue injury, just like you or I sprained an ankle, they can too. So this is the one I would say most commonly people are reaching for an ibuprofen or a Tylenol for their pet. And so definitely if you see that, don't do that and bring them in. Skin emergencies, lacerations, bite wounds, torn toenails, allergic reactions, and skin infections. And then I would also say, your itchy dog that has skin allergies, keeping you up at night, those types of things we definitely see through the ER. Lacerations and bite wounds are very common, especially here. All of our dogs are going to a dog park with many different dogs, and things happen there. So if you see any of these things, definitely bring them in. Bite wounds. Bite wounds are very common. Big dogs, little dogs, it doesn't matter. But the big thing is having them seen, because a dog's mouth has lots of bacteria, and these bite wounds can get infected very quickly. So even though it is just a small wound, we always say it's the tip of the iceberg, and the injuries you see are going to be underneath the skin. So even though you think, oh, it's just a small little wound, really we're seeing a lot more underneath there, and a lot of times these guys need to have those wounds flushed out, explored, and get and have antibiotics. Just the puncture wound. So if you have a laceration, just, your dog's running out, he gets cut by a tree or something like that, that's different because it's not something like a mouth that's full of bacteria. But, those lacerations, some of them can definitely just heal on their own, and that's not something I would say, if it's small enough, it'll probably heal, be fine, versus a bite wound. Allergic reactions. This is another very common scenario of our patients that come in. Most of the time, we don't know the culprit. They get in contact with something, they may have gotten bitten by something, or it could be vaccine associated, where they come in, the owners just say, oh, his mouth just got swollen all of a sudden, or he's got all these bumps over his body, which are hives. So they can definitely have this type 1 hypersensitivity, or basically an acute allergic reaction. So if you ever see your pet have a big swollen face, definitely bring them in, because these can progress to things, something like anaphylaxis and be a lot more severe. Most of the time, this is a quick in and out emergency room treatment. We give them some Benadryl, sometimes we give them a steroid, and then we have you guys give them Benadryl for the next few days, just making sure that things calm down. But most people ask, well, why did this happen? And I would say 99% of the time we just don't know. They just got in contact with something that they were allergic to. Torn toenails. Although sometimes this may seem silly, these can be quite painful. As we know, the dog's toenail, it's just like our nail, where there's a point where there's not any blood vessels, and we trim that. And then there's what we call the quick, and there is a blood vessel in there, there's nerves in there. And if they're running around or their toenails are long and get caught on something, that can rip off. These bleed a lot. And I would say that's most of the time people bring them in is because it won't stop bleeding. These can also get infected if it's not treated, because if you think of our pets walking around, they have an exposed blood vessel, they can definitely get infected. So if this does happen, apply pressure. You can also apply things like baking soda or flour that can help clot that blood on their toenail, and then bring them in to have it clipped and cleaned. Sometimes they may need some pain medications versus some antibiotics, but a lot of times it's just clipping and cleaning that area. Something to really try to prevent this is to get your pet's toenails trimmed. I would say most of the time these guys, it's the ones that have the longer toenails that get caught on something. So, doing regular toenail trimmings for your pet can prevent this. Sure.
Is the flour better than a sticking pencil if you can actually use one?
That probably works better, but I would say most people don't have those. Or there's something called Quick Stop that we use here. If you have that at home, I think you can probably buy it over the counter. But usually people just have flour at home. We just tell them to put it on there. And then lacerations, our long-haired pets, our Shih Tzus, those types of things that get that matted hair, we think, oh, we'll just cut this off, and then accidentally we cut their skin. So that's pretty common, and if that happens, I would recommend them coming in. They usually need a stitch or two, or sometimes it could just be a little bit of skin glue. We don't recommend hydrogen peroxide because that can be uncomfortable. And don't wrap it at home. Just, unless it's excessively bleeding where you need to apply pressure, just have them come in and we can take care of that for you guys. Because depending where it is, sometimes we can put wraps on too tight and that type of thing. Toxic emergencies. Yeah, so here is a list of common things that pets may get into that can have some very negative side effects. One is rat poison. Rat poison can be all around the city, and it's supposed to be something that the rats want to eat, so our pets definitely want to eat it too. There are two types of rat poison. One is anticoagulant, and so that is where your pet may be basically deplete of clotting factors and they start bleeding from places. And that is very treatable, fortunately. We just have one in the ER today. So we can treat that pretty readily here with some vitamin K. And if they're bleeding, we can treat them with some other products. The other one is something that unfortunately is not treatable, but they do have to consume a large amount of it for it to be toxic. So the big thing with that is if they are to get in rat poison, know what type it is, because we can really help them depending on knowing what type it is. If you live in an area where the city is putting down rat poison, asking them what type it is. I would say most commonly in the city they are still using anticoagulant, rodenticide, so just making sure you know what that product is to help us. Antifreeze. Unfortunately, antifreeze is very toxic to our pets, cats more than dogs. If for any reason you see your animal licking up antifreeze, bring them to the ER immediately. It isn't something we actually commonly see, but we do know how toxic it is, that we talk about it a lot. So if for any reason your car is leaking, it's very sweet, so they all like to lick it up, then just bring them in immediately, whether they're having signs or not. Human medications. This is probably your most common toxicity we're gonna see. Pain medications, antidepressants, anything that we take, our pets will eat. Surprisingly, cats too will get into bottles. And so, again, having called ASPCA if you know that your pet got into a medication, so by the time you get to the ER, all I have to do is talk to that toxicologist and see what their recommendations are. Sometimes we make them vomit, sometimes we don't, but we can then treat them appropriately. A lot of times, I don't know half of these medications that people are on because animals don't use them, and so having that resource of the ASPCA can help me and know the mechanism of that drug and what the effects may be on our pets. Xylitol. So xylitol is a artificial sweetener. And in our pets, it can be toxic for them. They can get a low blood sugar, and it can affect their liver. So, I have come home and my dog has eaten a pack of Orbit gum. And, we have our own panics in that moment, but definitely the small dogs can be more affected than the big dogs because it is dose dependent. So having them come through the ER and we can check their blood sugar, sometimes we check their liver values, and it's usually okay, but it's definitely something that if you do know you have this gum, or you just avoid buying that type of gum altogether. Sorbitol is fine, but xylitol is not. There's different plants. Lilies are the biggest culprit. If you have cats, I just recommend never buying a lily. Unfortunately, these cause almost irreversible kidney damage, so I would just recommend not getting them if you have a cat. Recreational drugs, yes, we do see a lot of marijuana toxicities through the ER. It is very distinct, and we can probably see that pet from a mile away and know what's happening. They're usually not fatal, depending on what drug that is, but they just need some supportive care, and they do okay. Some human foods, grapes and raisins. This is something that can cause kidney damage in our patients. We don't really know the mechanism of why it happens. We don't know a dose of it. You'll have many people say, well, I've been feeding my dog grapes for years and they're fine. So unfortunately, it's one of those things where we don't know why it happens, but just trying to avoid grapes and raisins, giving to our patients. Chocolate, this is another very common emergency. If your dog gets into some milk chocolate, this may be a time you call ASPCA poison control, and they could say, it's not enough, it's not a problem. They may have some vomiting or diarrhea, but they should be fine, versus that baking chocolate. So that's basically, your dog's gonna look like they ate a lot of caffeine. They're gonna be hyperexcitable, their heart rate's gonna be high, they may look a little crazy. Bring them in, because this can actually have very serious side effects. So if you do know that your dog got into things like dark chocolate, bring them in. Raw dough is something else. If they eat raw dough, basically they can get, it fermentates in their stomach and it makes alcohol, and they can be very drunk, and that can within itself have its own side effects. So we do see this, and if they do eat dough, bring them in.
Why doesn't that pass through more quickly like everything else?
It expands in their stomach, and so it's not going to pass through readily. Yeah, so all that yeast and everything within their stomach is just going to expand and ferment and turn, and it's just going to create alcohol within their system. Same thing would happen to humans if you ate it. So again, kind of everything we touched on, your clinical signs, it's all going to depend on the toxin that they ingested. Take a picture of it. Let us know what it is, what medications, what dosage you think it is, because all of that can help us a lot. There are spider bites and those types of things. If your dog was ever bitten by a snake, take a picture and then call ASPCA, which we have said. So additional tips, what to do. If you're far from a veterinarian and your pet got into something, ate something, you can make them vomit. We say a ml per pound, or some people say a tablespoon per 10 pounds. You can try it once. If it doesn't work, don't keep doing it. Hydrogen peroxide can cause a lot of irritation to the gastrointestinal tract, and so we don't recommend doing it over and over and over again. But if you can find either a local ER or primary care veterinarian that is around you guys. Yes, do you have a question?
Sure. I have a question about the hydrogen peroxide.
Sure.
Are there different types? Because I've read that it should be 3% food grade. Is that true?
Yeah, so the lower percent is going to be better because it's not going to be as caustic to their GI tract. So basically it's just creating an ulcer within their stomach the more that you give. So I would do a lower percentage of it. And most of the stuff that you're able to buy at CVS, Duane Reade, they're all going to be that 3%. And yeah, so don't re-administer it, and then we wouldn't recommend it for cats as they be more sensitive to that. I would say cats are very hard to make vomit, even with the IV medications that we have for them. Only about 30% of them vomit up foreign bodies. So unfortunately, that's just a cat. Another common emergency is going to be your respiratory emergencies. And heat stroke's on here, but heat stroke probably is within its own set of emergencies. But collapsing trachea, all of these little dogs within New York, the Yorkies, for whatever reason, they tend to have a congenital gene that over time their trachea can sort of break down and it collapses. So as they breathe in, that trachea collapses down, and it can be dynamic, or it can get pretty severe. And so if you see these little dogs with this sort of honking cough, it may be related to their collapse, or their trachea is collapsing down. And so when it gets hot or they get worked up and we create a lot of inflammation, they can't pass a lot of air, then they can get into a respiratory crisis. And we need to bring them to the ER as fast as possible, because this can become fatal very quickly. Pneumonia is something commonly, I'm sure all of you guys have heard things of the canine flu or kennel cough. Those types of things can advance to pneumonia. They can also get aspiration pneumonia. If they're vomiting and then they aspirate some of that, they can get pneumonia that way. Laryngeal paralysis, so this is going to be more of our bigger labs as they get older. They start panting and you just start hearing a lot of increased noise up there. It's because sometimes they can just have a degenerative process where in the back of their throat, what's supposed to basically open when we breathe, it's just not able to fully open. And then congestive heart failure. So yes, our dogs are also prone to going into heart failure. They can get degenerative processes, and basically they can get a buildup of fluid in their lungs, which creates respiratory distress. I think the big takeaway of this really is if you feel like your pet is having any trouble breathing, bring them in immediately. Don't wait. A normal respiratory rate for a dog is going to be 20 to 30 breaths per minute. And I would say normally it's going to be their effort. If they're just sleeping and they're just taking normal breaths, great. But if they're sleeping and you notice that their chest is in and out and they're breathing faster, bringing them in to be evaluated, because this could be very serious. You may see signs like coughing sometimes. The collapsing trachea or heart failure dogs, they can start by having a cough. And so we have this word dyspnea, which just means trouble breathing, or tachypnea, which is fast breathing. You may have the increased respiratory rate, or just more noises that you're hearing your pet make while they're breathing. And then cyanosis. So that is basically saying that we're not getting enough oxygen to our blood, and you may see them be purple. And obviously, if you have any concerns about respiratory breathing, just bring them in and we can evaluate them. Even if it turns out to be nothing, it is better to be safe than sorry. So heat stroke, we can kind of talk about this on a separate aspect, because heat stroke is something that we see. So our pets can't thermoregulate the way that we do. They don't sweat. They can't dissipate all of that heat the same way, and so they do that by panting. They're just not very good at it. So especially in New York, being hot in the summers, we're taking them out on a long walk, they're going to get a lot hotter than we are. And so prevention is the key when it comes to heat stroke. Those hot days, just don't take them on a long walk. Just don't take them to the park. And so what happens is basically their body's temperature gets very hot, and they can then, different organs can be affected by all of that heat. They're just not working normally. Usually the first signs you are going to see are going to be diarrhea. And so these guys will have severe diarrhea after. They just seem distressed or agitated, and sometimes they'll collapse. And so, with this, if you're ever worried that your pet has been too hot for too long, just having them evaluated by a veterinarian. The term heat stroke is something that can be used loosely, although there are specific requirements to truly be heat stroke. A lot of our patients will just be hyperthermic or have a high temperature, but they're able to bring that down and there's no abnormal side effects to that. But if you have that bigger dog that you took on a run and it's 100 degrees out, they are more at risk for that.
When you're applying the cold wash, when you're applying the cold washcloths,
Yeah,
where are you supposed to? Where's supposed
just
to
their
be?
whole body.
Okay,
Yeah.
So it's not just like
No.
whatever the.
Yeah, I mean, if you're trying to cool down your pet, just dumping water on them over their paws. So they also sweat a little bit on their paws so they can dissipate heat that way. But if you're trying to cool them down, you're not ice, but you just take cooler water because you don't want them to go from 105 degrees to 94 degrees, you know. But we do want to get them back into a normal range. So just some cool water you can put on them. If you are out with your pet on a hot day, just having lots of water available. You feel like they're getting hot, just pour some water on them, which can all help prevent heat stroke. Yes?
If I may, I just wanted to add a tidbit to that. Something you had said earlier is
Sure.
just so important. Many things you're saying is
Yeah.
very important for all of us. But at the beginning of the lecture, you mentioned the difference between coming to the ER versus going to the primary physician. There is a difference in thinking when we visit a critical care emergency vet than there is someone who has another specialty. So
Right.
stabilization is very, very important. The other thing I want to mention, having gone through a heat-related emergency, is something I learned after the fact. It's very important to monitor fluid intake during a hot period overall, because sometimes the animal may not be drinking enough, even with water out, to sustain themselves.
This
So
is right.
adding chicken broth, something that they like, that they're drawn to, could be helpful to encourage them to drink.
Yeah, absolutely. I would see more on the heat stroke, their body's probably going to tell them to drink water, versus if we're talking about, you know, dehydration, things like that, where our pet's not feeling super great, adding chicken broth, those types of things. Canned food has water in it to keep them more hydrated as long as they're still willing to eat that. The next one is also, these are all also very common, but neurologic emergencies, seizures. So our pets have seizures for many different reasons. One of them also could be heat stroke. You know, they can get epilepsy, toxin-related seizures. They can get intervertebral disc disease. Just like us, they can get a herniated disc, which can cause them to have a lot of discomfort and even some trouble walking. And then toxins. You know, marijuana toxicity actually causes some pretty severe neurologic abnormalities that we see. And so these are very big things. The first is if your pet has a seizure, a first-time seizure, they've never had one before, they recover from it. You know, there's really not that much that we do through the ER. Definitely worth calling us, going through it. If they get back to being normal within an hour, we would probably just recommend watching your pet, as they can have so many different reasons to have a seizure. If it happens again, then bring them into the hospital. If they're known to have seizures and they're being treated for seizures and they're having more than 3 seizures in a 24-hour period, they need to be seen. So basically our body has a seizure threshold, and every time we have a seizure, it's easier to have another seizure and another one. And so that's why we recommend if they have more than 2 or 3 in a 24-hour period that they should be seen and we should intervene. So, you know, seizures are common, but you shouldn't be that scared when they do have them. The biggest thing is, you know, some people think they need to get really close to them. You know, some people even put their hands in their mouths. These are times when your dog does not know what's going on. They can be very abnormal after the seizure. They could bite you, those types of things. So giving them space, making sure that things are clear around them, but letting the seizure just take its course. If the seizure is lasting a long time and it's not ending, you know, within 30 seconds to a minute, then, you know, being able to pick them up and bring them in is going to be important then.
Do you consider, I know it's not a seizure technically, but vestibular, do you suggest that it's an emergency?
I do, you know.
Stabilize?
Yeah, so vestibular events. So when we talk about vestibular, that's basically a really bad case of vertigo. And this can happen for many different reasons. But I would recommend that if you see your pet very wobbly, their eyes may be moving back and forth, they may vomit because they feel just very dizzy, I would bring them in because there's usually an underlying cause depending on, you know, how old your pet is, and so a workup from that would be worthwhile. I think they kind of talk about it a little, but basically seek veterinary care. You know, back pain. If your pet is having any sorts of back pain, or they're walking and they're kind of scuffing their legs, they're kind of wobbly in the way they walk, then definitely having them seen to evaluate things like their back or their neck, which could be a culprit of why they're having trouble walking. So if you have a puppy or a kitten and they're very small, they're not very good at, basically if they're not eating a lot, they can't maintain a normal blood sugar. So these guys, if your blood sugar gets very low, you can have a seizure that way. So if you have a puppy or a kitten, you can apply maple syrup, honey, Caro syrup, those things to the gums, and then having them evaluated. Also, if you have a diabetic patient and maybe they weren't eating very well and they got their insulin, maybe their blood sugar got really low and they could have a seizure at that point too. And this says here, don't put your hands or fingers near their mouth. Again, these guys can bite you. It may take them, you know, an hour, 2 hours to come through their seizure. It's called a pre-ictal phase, so that's before the seizure, and then a post-ictal phase. And so that post-ictal phase is you just don't feel normal, you're not quite sure what's going on, and that kind of takes you some time to get through it. So overall, that's kind of our presentation. What questions you guys have?
You mentioned that if there's a problem with back injury or something, to not manipulate, to be careful with manipulation. Well, are there guidelines to follow in getting your dog to the vet so that you don't pick it up and harm it further?
Yeah, I mean, I think it's okay to pick them up. We usually recommend, you know, if you pick them up from the belly, that belly is going to put a bunch of pressure on their spine, and so that, you know, a lot of times the owners will come in and they'll say, I think he has belly pain because they picked him up and he yelped, but really all that pressure is putting on his spine. We pick them up from their back end and then their front end. You kind of like scoop them up like this, and that's probably the best way. You know, if you're thinking that your pet may have gotten hit by a car and there may be something more like a spinal fracture, then, you know, definitely less manipulation in that way. If we're talking about a herniated disc or back pain, yes, we want to minimize manipulation more due to the discomfort, but it shouldn't make things worse.
Hi, I have a few questions.
Sure.
One of them is about ingesting things. I once had to give my dog the Heimlich maneuver, even though I had no idea how to do it.
Uh-huh.
He was on the street and decided it was a good idea to act like a snake and ingest the chicken breast.
Okay.
And so the bone got stuck in his throat, and
Yeah.
he was like trying to stick his paw in his mouth. And
Yeah.
So I was desperate because I saw he couldn't breathe. So I kind of faked the Heimlich maneuver, and it worked.
Well, that's good.
The big chicken, it flew out, and then immediately he wanted to eat it again. But
Sounds about right.
yeah, he's afraid of the vacuum cleaner. But so is that okay?
I can honestly say I've never done the Heimlich remover. I've definitely reached in my own dog's mouth and pulled out things like a rawhide. It depends on where it's stuck. You know, most of the time versus humans, we take a curve down this way, and so the Heimlich maneuver really works to get things out, where our dogs are kind of a straight shoot. And so if it's going to be stuck in their airway area, a lot of times you can, if they'll let you enough, you can reach in and get it.
Most of the time I would do that, but I was afraid because the bones were sharp that I didn't want to tear the back of his mouth.
I mean, even if he got a tear back there, it'd probably heal very well. Things in the mouth heal well. But, you know, maybe the Heimlich maneuver is something we need to look into.
He's kind of big chest and
Yeah. And that does bring up something. We definitely see where bones and stuff get stuck in the esophagus. So if your pet swallows something and they're kind of like, and they just are like lip smacking, they may be drooling, they definitely can get things stuck in their esophagus, which is also an emergency. When we go in there and we scope things out.
Okay, and just two more quick questions. When you said give them a light diet, like sometimes if they're having diarrhea, the problem with my dog I end up finding out is that he has problems with chicken and rice. So then when the vet kept telling him, give him chicken and rice, or
Right.
they gave him like a science diet that had chicken, he kept getting worse and worse, and we found that it was the chicken and rice.
Yeah.
You know.
And I
Is
think
there
it's
anything else that I sometimes give him a little sweet potato.
Sure.
or something.
I think sweet potato is actually very good because it has a lot of fiber, and so that can, harden things up. You can give them some Metamucil. That can help too, just like a tablespoon of Metamucil. And, if you have a pet that has food allergies and switching their diet is going to make things worse, don't switch their diet. Just keep them on their normal food, because I think we have to take it a patient-by-patient basis, and we definitely have patients that have severe food allergies, which if you feed them something else, they're going to get worse diarrhea. And on that, I would just recommend maybe adding some Metamucil or some canned pumpkin, something like that, and keeping them on their normal diet.
Yeah, I figured it out myself. I actually give him a diet that has the food is venison and chickpea,
Mhm.
grain-free, and then I add some ground beef for extra flavor, and he's perfectly normal now.
That's good.
Yeah, and the last question I have is about when you're talking about the poisoning. As far as with my dog, I find that, in New York, of course, they put a lot of that like white fertilizer stuff all over the grass, and like then also what happens is he'll get like cracked paws.
Okay.
The pads, and so
Yeah.
like how would you clean that up? Because I found that he might get some inflammation. Then I don't want him to start licking it. I clean the feet, but how would you deal with the
I think-
cracked paws and or that fertilizer?
Yeah, I mean, the best thing to do, definitely from the salts we see that, where they'll get it's very caustic to their paw, and wiping their feet. You can always use the little booties. In terms of the fertilizer, I haven't seen that. But if they get cracked paws because it's really dry, you can put lotion. I mean, it is keratinized tissue, and so you can put a little lotion on it. But if it's, infected and painful, then I probably wouldn't, and I would just, if it's really painful, we can wrap it and those types of things. Unfortunately, the paw pads don't like to heal very well, so it takes a long time for that tissue to kind of come up and fix a laceration or anything. But if they're stepping on something caustic, then wiping it off immediately is going to be the best bet for them.
Right, but what about the pavement? Because if they do a lot of walking and stuff, and my dog's a tripaw,
Yeah.
so it's very hard on his feet.
I mean, the best thing is going to be a booty. If they're on a pavement a lot, they're going to build up calluses. And so, the more they're used to walking on cement, the easier it's going to be. But I do think that those booties help.
Okay, thank you.
Could you talk a little bit about frostbite? Do dogs, their ends of their ears or their noses in really, really cold weather?
Yeah, they do get frostbite. It's going to be mainly those pets that are living outside. Our pets that are just out a little bit and then back in the house, usually okay. But yes, it's going to be the tips of the ears, the tail, because we just don't have as good of a blood supply to keep things warm. So we do see it, but we usually see it in more abandoned pets that are outside.
I've heard that xylitol is in peanut butter now.
Yes, I've heard that too. So I think it's just important to look at all these artificial sweeteners and know what's in the product that we're giving our pets. And I think most of them use sorbitol, but yes, xylitol is in peanut butter now.
This is a quickie. Can you talk a little bit about electrocution from the streets and what we need to do if that happens?
Yeah, I would say electrocution doesn't commonly happen from the streets. It usually is going to be that puppy that is chewing on a cord at home, a kitten that's chewing on a cord. And so what happens is they chew on that cord, they get electrocuted, and they usually get pulmonary edema. So they usually have some ulcers in their mouth, but they acutely are having trouble breathing. And I've really only seen it in puppies and kittens, but yes, that happens. Yeah, so again, any respiratory thing, you're gonna usually see it manifest as they basically get all this inflammation and edema within their lungs. They're gonna be breathing very fast.
Hi, I've got two cats, and they have a tendency to become constipated.
Okay.
One had hernia surgery already. The other one's a long-haired cat. So I give them treats for hairballs.
Yeah.
But can it be that going to the bathroom every 2 or 3 days is their norm?
Mhm.
Is that
Mhm.
and when should I start getting nervous about not going to? Because
If they're straining and they're having trouble, if a cat that is truly constipated, they're usually vomiting, they're meowing, they're in and out of the litter box straining. Some people think that they're having trouble urinating, and this is one thing that wasn't on the PowerPoint that also should be talked about. If your male cat is in and out of the litter box, not urinating, not producing urine, that is a medical emergency. They can get obstructed and not be able to pee.
Mine are female, so
Yeah, so
don't have that problem.
I think
But they're
that's,
not straining.
yeah,
It's just that it seems to be that it's normal for
yeah,
them.
and that may be completely normal. Again, a lot of these emergencies is your clinical picture of your pet. Yes, my pet is having some diarrhea and he may have vomited twice, but he's otherwise bouncing off the walls and acting normal. Then he's okay, But the minute he stops eating, he's lethargic, he doesn't feel well, then I think it is definitely worthwhile to come in.
Thank you for answering all of our
Sure.
questions. I have a question related to CPR. For many, many years, there's been a standard in human care. Every 5 years, those standards are revisited by emergency councils. And I've been following what's been going on regarding pet CPR, not
Yeah.
to take the place of coming to the ER.
Sure.
So my couple of questions, is the standard now of CPR 30 compressions to 2 breaths? Is that followed?
So for an animal, you should be doing 120 beats per minute. And, CPR is a very technical thing to do. And I would say unless you're trained in it, you may end up doing more harm than good. But yes, any CPR in a dog or cat should be 120 compressions per minute.
Okay. And there's something I read recently I've never come across called an abdominal squeeze.
Yeah, so that is most commonly done in larger breed dogs where you're alternating chest compressions with abdominal compressions.
Okay. And my final question, if I may, is,
Mhm.
do you use an automated external defibrillator here at AMC?
We do. Yep, but it is only for a specific rhythm. So if your animal is in ventricular fibrillation, just like a human, then we would defibrillate them. And it's not as common, but we definitely have done it.
Thank you so
Mhm.
much.
Excessive grooming in cats, what could be the problem?
Excessive grooming in cats is probably a behavioral issue. It could be an underlying skin infection, something like that, but it's usually a behavioral issue. Stress. We've been now documenting things in our patients now because we do more behavioral medicine. We're seeing OCD behavior, stuff like that. So it's probably an underlying behavioral issue.
I know that the education center is just getting started, but are there additional first aid classes to take?
There aren't currently, no, but that's a good thing we'll look into.
Red Cross used to do them regularly.
Yeah, so we do them for the NYPD. They come through once a year and we teach them sort of basic first aid stuff for crisis, car accidents, stuff like that.
I just have one question about stopping bleeding.
Uh-huh.
I've worked with dogs that have tongue bleeding or, the paw.
Yeah.
What's the best practice?
Tongues are hard because the mouth bleeds a lot, and obviously you're dog's head is everywhere and, probably ends up looking like a murder scene after that. Just honestly getting them in, because those dogs we have to sedate, those types of things is probably, it depends where the bleeding is. If it's a tongue laceration, then we usually suture it up. If they've just cut their gum up here, it's probably going to heal on its own and stop on its own. But you can always, hold compress to it, but it's just harder when it's in their mouth.
I have a quick question about, when animals have various tests like x-rays or sonograms.
Uh-huh.
Now, some places will sedate your animal and some won't. And then also the difference between having it done at your primary doctor versus going to a hospital like this, and in terms of having them look at the x-ray or sonogram and then a radiologist.
Yeah, I mean, that's a good ER question, because there's lots of imaging done with all emergencies. We rely on x-rays, ultrasounds, and there is a big difference when it comes to a radiologist versus an ER doctor or a primary care veterinarian. So, x-rays, they're probably going to be the same at your primary care versus here. We all pretty much use digital x-ray these days. In terms of sedating your patient, I would say we sedate animals that are very wiggly or painful because we want to get a good x-ray. I can't tell Fluffy to lay there and hold his breath for that good x-ray. So we do like to sedate them because we want to give you the best bang for your buck. If you're going to pay for these x-rays, I want them to be readable. I want to be able to give you a diagnosis. And then also it decreases the radiation for us, because if we are in there all day holding pets, we are exposing ourselves to radiation. So, you go over to the United Kingdom and you're not allowed to be in there with the animals. So they are all sedated, and then they are restrained with tape and things like that. So we do try to minimize our exposure to radiation that way. And it's just a case-by-case basis. In terms of an ultrasound with a radiologist versus, even through the ER, we use an ultrasound very differently than a boarded radiologist is ultrasounding. I can look at your pet in the ER. I can look for free fluid in their abdomen. I can look for large things like masses or, a large infected uterus. I can see those things very well. I can look in their chest, see free fluid. But, I don't do ultrasounds of the abdomen all day, every day. And so that's where our radiologist comes into play. If I need a look at all the organs, that type of thing, I would recommend an ultrasound with a radiologist, because they're going to know those small intricacies of, how the intestines look, find the adrenal gland, those types of things. So to me, they're invaluable. Having them look at an x-ray, they just see things that I don't always see. So they are key.
If we've had an ultrasound done at our regular vet, can we come over here with that and
Usually,
be able to make an evaluation based on that report?
that depends. Sometimes your primary care veterinarian can take images from the ultrasound and send them to a radiologist. Sometimes there's a traveling radiologist that goes to primary care veterinarians. So, and even our general practitioners have taken ultrasound courses and those types of things and can look for big things. So, I think it just depends on the practice. And, obviously our radiology department is very good in helping our primary care vets all around. And so if there's ever a question, your vet is more than welcome to contact our radiology service.
I just want to point out that a lot of vets have arrangements with the Animal Medical Center to read the radiographs that are done in the office.
Yep.
I mean, I work in the animal hospital at Vestibular, and we routinely, if the doctor, thinks a radiograph consultation is appropriate, we send the images, and Dr. Fischetti,
Yeah.
favorite,
Everything's digital. We can just email it.
pretty quickly with a report. And there's also arrangements for echocardiograms.
Mhm.
We have that outpatient echo program that I'm constantly making referrals to. So, there are we just send them, you know, we make the referral to have an outpatient abdominal ultrasound, or we'll differentiate where we think they need to see internal medicine and do it as a, you know, regular patient, and have the pet seen by the internal medicine department as well.
I think you have to be just, I totally agree with you on the other thing is that sometimes you have to be more proactive with your primary care vet, because I have a great one who said, you know what, we're not gonna do the echo here, go to, I think it was Dr. Pichetti, get it done, then we'll read them together, but a lot of vets don't recommend that, so you should, I think, bring it up, rather than a traveling person who can't always be as good as the people here.
We'll take one more. Oh.
I just wanted to add something for anyone that has an active membership with Home Again as the microchip, and I don't know if other microchip companies do it, but you can call poison control through the Home Again number, and they don't charge you for that consult, but you have to have your membership active with Home Again.
Flip side of the frostbite, sunburn, sunscreen, and not an emergency thing, but what's your opinion on shaving dogs?
I don't recommend shaving your dog. Well, you know, it depends, right? The long-haired dogs need to get groomed. But, you know, the German Shepherd, the Golden Retriever, unless, you know, they have a reason or, you know, more of a hygiene thing, they actually thermoregulate better when they have a coat on. That's what it's for. So shaving them actually isn't going to change how they thermoregulate, because again, they don't dissipate heat through their skin. So sunscreen, it's going to be most important for those pit bulls with pink noses, those types of things, where, you know, the lab with the pink nose, but most of them, they don't need it.
How do you do it without them licking it off?
Good question. They probably would. Being sunburned isn't something we commonly see.
Have you ever treated rabbits in?
Yes, we treat them very commonly. We see all exotics here at AMC, reptiles, rabbits, guinea pigs, for every type of emergency.
What's the most common?
GI stasis in
Yeah.
bunnies.
Yeah.
Yeah, so that's very common, and we have an exotic service here, so if we have any questions, we can always contact them. Obviously the ER, you know, we aren't the most versed in all exotic issues, but we can treat the basics and contact exotics when we feel uncomfortable.
Thank you, everyone.
Thank you.